Hey, I'm Liamith,
My name is Jay, and welcome back to the Medical Frontier.
where we talk about today's inventions, which are tomorrow's standard of care.
Yeah, so in this episode, we're going to be talking about a new way, or a way that's been proven that's better and less invasive than EVD, which is a more invasive way to measure intracranial pressure in the brain. So why don't we get started and learn a little bit more about the more invasive version first, which is the EVD.
Yeah, so basically, first to start off, increased intracranial pressure is an increase of pressure in the brain. And it can lead to long term brain damage and sometimes even death. So it's critical here that we have a way of monitoring the pressure in the brain. So, as far as an EVD, it stands for external ventricular drainage. And so the reason that this is done is to reduce the pressure caused by a um, buildup of pressure, whether it be because of head trauma, whether it be because of neurosurgery. But basically, the drain is inserted through general anesthesia and stays in the body for up to 14 days, based off of how it affects the patient. And then from then on, it will be removed after it's done its job. But this does require the help of a neurosurgeon, and it is very intricate. I mean, it is as any surgery would be, but it's very invasive to say the least. And obviously, to put the patient under that would be a lot of stress, and it's it's a significant procedure that we want to avoid if at all possible, which is why there are other ways of measuring intracranial pressure, not to the extent that the EVD would, but it would still give us a signal to whether or not that there would be an increased risk for intracranial pressure, which is something that we would really want to know just to help the patient have the best quality of life going forward.
Exactly. And the EVD, like Liam was saying, is considered the gold standard for actually measuring the ICP, which stands for intracranial pressure, since obviously it is the most accurate since you're literally draining into the skull and getting measurements based on a probe you put in. So obviously that is the gold standard like they say it is because it's the most direct way to actually measure the ICP. But like we were mentioning, it's also really invasive, and that might not be the best solution for a lot of people because, especially if there's people on blood thinners and risk of bleeding risk, drilling a hole into your skull is definitely not the best method or option to go. So, especially in populations like that are on blood thinners, like I said, it's better to avoid this procedure and go for a more non-invasive method, which is where the ONSD comes in.
Yeah.
Yeah, so ONSD stands for optic nerve sheath diameters. So basically, what it is that they take a normal ultrasound, they use a linear probe with an ocular preset to actually go in your eye and measure the diameter of the optic nerve sheath. And what happens with that is basically if there's more intracranial pressure, the diameter of the sheath increases. So in a normal patient, that diameter is normally less than about 5 millimeters, but with patients that are experiencing high intracranial pressure, that is usually greater than that 5 to 6 millimeter threshold that we normally see. So it's a very great way to actually see or have a slight indication to see if there's patients that are having high intracranial pressures because, like Liamith was saying, it's a very dangerous situation to be in if that is a possibility since it can cause morbidity, mortality, and even long-term brain damage.
Yeah. So to go ahead and bounce off of that, so in terms of ICP and in terms of knowing when to have these ultrasounds done, there's not much that could be specific to this situation, right? So in terms of clinical markers, a lot of the different markers that we see, like lack of energy, weakness, changes in your behavior, vomiting, blurred vision, a severe headache, all these different symptoms are not specific to increased intracranial pressure. Yes, there are symptoms, but we don't know if that's the sole reason, right? So there's a gap in finding a way non-invasively to be able to measure intracranial pressure without actually doing an invasive procedure and having a clinical marker that indicates for sure an increased intracranial pressure situation. And so, in terms of the intracranial pressure itself, it is fluctuating like all the time. Like if I sit up, I mean, obviously, like if you guys hang over the edge of your bed, there's a lot of pressure that goes to your head. Like any situation that you're going to be put into, it's not going to be the same. However, what classifies as an increased level of intracranial pressure would be that pressure maintaining for 5 minutes or more. So that's when we see there's a need for a device that needs to be able to measure this non-invasively, potentially through ultrasound, potentially through other means. But as far as we know right now, I mean, the amount of resources that would take to completely keep monitoring individuals, and it's just in the span of 5 minutes where that can happen, and that 5 minutes of increased intracranial pressure could lead to so much more. So especially in like low income countries where sometimes they may not have ultrasound machines. I mean, it's a low possibility, but that's obviously something we still have to account for. And having a clinical marker that say, okay, if this, and this are there, then for sure they have increased intracranial pressure. I mean, you can't say that with everything, but just have some sort of indicator would be huge, especially with this. I mean, it can, and the thing is, the increased intracranial pressure can result from bleeding in the brain, a tumor, stroke, high blood pressure, brain infection, head trauma. It can result from anything. So it's a very variable situation. It can be caused by a variety of things. And yeah, so there's also another way of measuring this, but this way again is invasive, just like how the EVD was. So according to Johns Hopkins medicine, there is a way of placing an intraparenchymal pressure microsensor into the brain, and once again it would be placed by a neurosurgeon in an operating room with general anesthesia. So again, it's the neurosurgery aspect of it. There's not going to be enough resources in everywhere across the world in hospitals for them to be able to implement this, and it's very, it's not particularly time consuming per se. I mean, there's only a 2 to 4% risk of infection, but it still has its risks and it still has its cons. So yeah, that's a little bit more about ICP, just to give you guys what it is, what can be caused, and for you kind of have a better understanding. If you want to go into the anatomy of the optic nerve sheath, exactly where it is, and what are some typical guidelines to see how wide the optic nerve sheath should be if we're talking about measuring it, Jay?
Yeah, basically what it is that, like I was saying, it obviously increases because of the extra pressure in there, and what happens is the CSF, the cerebrospinal fluid, that also increases along with the actual nerve sheath expanding. And one thing I wanted to say that was adding on to what you were saying about people in countries that may not have the facilities that we have here in the United States, and how they can have a more or better indicator instead of actually having to do the entire invasive procedure, is that not only if it's people in those type of countries, even here, even when we have all the facilities, there's still patients that it might not be suitable for everyone, the invasive method. So like I was saying, the people that are on blood thinners, that have some heart defects, so they need to take blood thinners, or if there's people prone to thrombosis for which they might need to take blood thinners for, such as blood clots. There's always patients come in all types, patients come in all conditions, so there's no way that this one invasive method can fit for every single person that there is. So it's always good to have another method, and seeing that this is non-invasive, it's just a really good indicator. And I wanted to ask you, Liamith, could ONSD be better than EVD, and are there any instances of false positives happening? So basically, how accurate is the ONSD method?
Got you. Yeah, so that's a great question. There was actually a study done in India about measuring the ultrasound evaluation of the optic nerve sheath and how that correlated with increased intracranial pressure in traumatic brain injury patients, right? So as I said previously, the increased intracranial pressure could be by head trauma. And surprisingly enough, it was extremely accurate. I mean, there was a false positive, the area under the curve for the mean ONSD was 0.754. So it's good discrimination between the true and the false positives. And additionally, the accuracy of the ONSD measurement was calculated as 83%. So that's extremely high for something that is non-invasive, and it's a huge revolution in this. I mean, there's a huge number of statistics that we have here that the the patients without increased intracranial pressure, their the brain the sheath diameter was in between 4.6 with a plus or minus of zero point 0.2, so it was right underneath that 5 mark. So again, just another study that shows that this is a pretty accurate way of evaluating things. Obviously, it's not something that, like we have the sensor from Johns Hopkins or the external ventricular drain that's constantly monitoring. See, that's a huge downside to this, right? Because when we're doing an ultrasound, it takes only 5 to 10 minutes, right? And so when it takes 5 to 10 minutes, how many times do you do this over again? And like, how often is it supposed to be done? You're not constantly going to be able to monitor this, right? So like, what happens if in the middle of the night something like, then it increases? Like, you don't know. So it's yeah, but overall it's a great non-invasive way as of right now. And actually the sensitivity of the bedside measurement to detect increased ICP was 86.42%, and specificity was 64.3% compared with the results from the CT scan. So it was pretty significant in noticing that, even compared to CT scans, which is a huge technological method used in the healthcare field as of right now. But
Exactly.
yeah.
Yeah, and something else, like when we were doing research for this episode, we found out like how they actually do the ONSD, and we learned that actually they use it in a lot of emergency medical scenarios as well. When they don't, like out in the field, you don't always have like your like all the fancy equipment you might need to do the neurosurgery to actually place the probe in and drill into the skull and having to do the entire procedure of trying to find the ICP through there. So it's just a great way, an easy way, and a quick way, mainly to find out if there's any indicators of a high ICP. So what they do is the patient is always laid down in a flat manner, and what they have is, like I was mentioning, the linear probe with the ocular preset. They actually push it a little bit into your eye after they put like some film or some the ultrasound fluid over it, and it's mentioned that it never hurts really. You might just feel some pressure on your eyelid when they're doing the initial ultrasound, but it's never usually something that hurts. So that's a really big plus when looking at or when comparing this to the invasive procedure. So the fact that it's not the fact that it's painless and it doesn't hurt, and the fact that it's quick and easy as opposed to the invasive method is also a really big pro for ONSD compared to the EVD and the other invasive method.
Yeah, that's a great finding, because again, if we're talking about in like simple accessibility, again, obviously, I know I said that the ultrasound machines could potentially not be available in all hospitals around the globe, but also you also have to think, if that's not available, then what would be the reason for a neurosurgeon of that skill and them to have the resources to buy such sensors and have such technology to be able to do these external ventricular drainages and whatnot. So again, it just comes back to that resource perspective of having an ultrasound is the simplest of technology machines, right? No matter where you go, you're probably going to be able to find one, but it's not something where everybody in the world has one. So you just
Mm-hmm.
have to account for that, that chance. But as far as like having skilled neurosurgeons, I know that in some of those other countries that people are not able to be there all the time, and neurosurgeons sometimes have to float around hospitals, or one day they're not here, one day they're not there, and you know I don't think that it's something to gamble with. And I think that's where the ultrasound comes into play, that it doesn't require the greatest experience to be able to do and to be able to read. um,
Exactly.
so I think that's a huge plus, and that technology again is just way more complicated than an ultrasound, so it would take a lot more skilled individuals to be able to maintain it and make sure that nothing goes wrong with it and whatnot,
Mhm.
even after it's implanted in the brain. So yeah.
Exactly. And adding on to that, ultrasounds are actually very, very portable compared to other
Yeah.
methods. So it's, like bedside manner, bedside applications of it are really, I don't know, like really expandable. Not only can, like I was mentioning, not only is it available to you in hospital, you can have it in emergency medicine scenarios. You can have it maybe out in the field for tending to any sports-related injuries. I know football, Liam, if you're interested in it, football, you can see like a lot of applications for ultrasound usage and potentially measuring ICP in there. Basketball, basically any sports that require or have like high or are considered high contact sports, you can see like really high usage of these. And not only that, there's also many implications. Maybe a good thing I was thinking about was having use of this in the military. If you're in high combat zones and places like that, we can't even imagine it. But obviously there's going to be people in the armed forces facing stuff like that in their day-to-day lives with maybe high intracranial pressure, maybe due to stress or strokes or just with all the conditions that come in that. So yeah, there's a lot of application to this.
Yeah, and I think what you brought up is a huge point about the portability of an ultrasound, right? And I know of many. I just looked it up. There's a portable ultrasound devices that are available that are handheld that you can take practically anywhere, and these have been tested with optic nerve sheath diameter ultrasound, and they have been accurate as well. So again, just another plus to having this portability and being able to um, move it around, go into the field, go into various areas, go into various rural areas with these portable ultrasound machines and be able to have that and utilize that. And, not being a requirement of having access to electricity and potentially being battery based. And there's just a lot of room for growth there. I think when we're talking about back again with this increased intracranial pressure and in terms of measuring it, the the gap and the issue that comes into play is finding a way to measure it accurately but without being invasive. And I know we've said this 1,000 times, but you can't that's the huge thing here because finding a way to revolutionize medicine, this would be a way to revolutionize medicine. Like this is
Exactly.
one of the key ways that nobody has really found around to measure it non-invasively and to just find an easier way so that they don't have to go through procedures just to know what's going on inside the brain, and to
Hmm.
know the level of pressure. So if there's a device that we can, a cheap device so that it would be accessible to everybody again, to develop to perhaps measure the optic nerve sheath diameter and something like that, I think that would be a huge discovery and potentially to even look for other indicators and look for other ways of accessing the brain's pressure, because another thing that we have to think about is the reason why we're doing the optic nerve sheath diameter is because we can't do an ultrasound anywhere else because the skull is there. So the only ways of accessing it would be through the eyes. So that's the
Exactly.
only way how we know. So if that's the only way how we know, then like how are we supposed to do that else non-invasively? Like there's simply like very little room there for technological advancements in order to find a way to do this more accurately.
Hmm.
Um, but yeah, I think that's where the biomedical engineering comes in and what people have been researching so far. But yeah,
Exactly. Yeah. I think the biggest part of what you were saying is about how applicable it is in areas that are like more prone to poverty or don't have as much money, because like those areas we see are usually the ones that are more prone to people facing things like sepsis or encephalitis and things that have to do with the brain and disorders like that that can directly result in ICP and high pressures in the brain. So having that
hmm
way to detect ICP without actually doing the entire procedure is the biggest plus. And is there something you have, Liamith, about what doctors are saying about ONSD?
yeah. So as far as doctors are saying about it, I mean, it has been shown to be extremely effective, and I think many doctors have promoted the usage of ultrasound optic nerve sheath diameter just for the fact that it's non-invasive and it takes a lot of time out of the picture in terms of utilizing their time to go out of their way to do external ventricular drainage systems and put those in place and stuff. Obviously, it's not the greatest, it's not the best way to do it, but it's a great way in terms of cost, in terms of efficiency, and in terms of time constraints. It's a very effective method that I think a lot of people, especially with the study that I just told you about, I mean, there's concrete evidence that it works. So why not use it? You know?
Hmm.
But yeah,
Exactly. And even more important than what the medical professionals are saying, what patients are saying, especially since what we were mentioning about how painless it is and how quick it is, it's something that's really preferred by patients as well. Especially when you look at more vulnerable populations like um, the older population or children that are young that might have or that might not be comfortable or their parents might not be comfortable with them having like a whole invasive procedure done on them. It's a great way to understand what's going on in the brain, but also have like a quick and easy indicator as to if there's more urgent measures that need to be taken to prevent further damage.
yeah, yeah. That's a great way of wrapping it up, Jay. Uh,
Exactly.
I think this was a great episode. I'm very happy the way that it turned out, and obviously we urge you guys to go out there and find a way. Maybe you guys can figure it out and find a way to measure it non-invasively. If so, that would be great. Just give us a little bit of credit. I'm joking,
It would be
but
revolutionary.
yeah, yeah, it would be revolutionary, and we thank you guys for watching us today. And Jay, any last words?
Yeah, we really appreciate you guys' support. If there's any ideas or any topics that you'd like us to discuss in the future, please let us know down in the comments below. And we really appreciate you guys joining the journey of us learning more about these disorders and advancements in the medical field. And we hope that you learn as much as we do while making these. So thank you so much.
All right, thank you guys. Have a great day.